Sterilization reversal. This is a simulated patient task. The task covers information gathering, communication with patient, applied clinical knowledge, patient safety. You are the SD5 in the clinic about to see a lady, Claudine Gomez, 37 years old, who has had previous 3 caesareans with tubal sterilization done during the last caesarean. She is here asking for a reversal of sterilization. She is upset with the circumstances under which the procedure was done. Your task is to take relevant history, address her concerns, explain management plan. Hi, I'm Dr. Ankita, one of the doctors here. How would you like to be addressed as? May I confirm your age, please? I believe you are here as you would like to undergo a reversal of sterilization procedure. Is that right? Yes, I'm seriously upset with you guys. The last time I had a baby, the doc said it would be risky for me to get pregnant for the fourth time, and it would be better to get the procedure done. I know of a couple of friends who have been pregnant for like 4 times and 5 times, and they are fine. Why would the doc say that to me? I can see you're upset. I will try my best to address all your concerns. Is it okay if I ask you a few questions if you don't mind? So could you tell me a bit more about your last pregnancy? Why was the cesarean done? Yes, if I remember correctly, the doc said it was placenta previa or something like that. I had bleeding. They rushed me into the theater and they convinced me to get ligated, and there I was. I feel so cheated. I'm sorry, Claudine, that you feel that way. The risk of pregnancy increases with every cesarean, and if you had a placental complication the last time, the risk of that happening again is high. And it's also possible that the placenta could get stuck to the wall of the womb, and that could be serious. It may lead to massive bleeding, sometimes requiring removal of the womb. Am I clear, Claudine? Yeah, but why offer such a procedure like sterilization? Generally, Claudine, we do explain all our patients that the procedure is permanent before taking consent. I will look back into your records and we could carry out an investigation if you like. Claudine, is it okay if I ask you certain questions? So what about the other 2 pregnancies? Were they complicated? Don't mind me asking, why exactly are you considering this procedure? Did you undergo any other surgeries? Currently, are your periods regular? Are you having any medical problems that you're seeing your GP for? Any allergies? Is your husband fit and well? Has he been tested? Are you well supported? Do you smoke? What about alcohol? Any recreational drugs? Are you vaccinated for rubella? Are you aware of your weight for height? Thank you for all that information. Is there anything else you want me to know? Well, Claudine, let me begin by telling you that before considering the procedure, you may be offered an X-ray test to look for the available lengths of your tubes. Your husband may be offered a semen test. The procedure involves cutting the ligated segment and joining the rest of the tubal segments. We would also go through your notes to check what procedure was done the last time. Generally, it is a low-risk procedure, but no procedure is without risks, and in view of previous surgeries, there is a possibility of adhesions and difficulty that could be encountered to perform the procedure. Rarely, it may not be possible to carry out the procedure at all. Am I clear? The success rate of the procedure varies. A pregnancy rate of up to 75% have been observed. Chance of a pregnancy reduces as age advances, Claudine. There is also a risk of pregnancy happening in the tube, which may sometimes burst inside your tummy, resulting in bleeding. So we will need you to follow up as soon as the pregnancy test is positive. I would give you written information regarding the procedure. Other options that are available to you are test tube baby, surrogacy, and adoption. For these, we could refer you to the fertility specialist. Am I clear, Claudine? Also, Claudine, I need to inform you that the procedure or the IVF may not be funded by the NHS. However, I could write to your GP who would refer to the clinical commissioning group for advice. Why is it not funded, doctor? I'm sorry, that's the protocol generally followed, as the sterilization procedure is considered a permanent method. Is there anything else you need to ask? So I will write back to your GP and discuss with my consultant. Thank you, Claudine.